Hi, my name is Melissa. I'm a population health specialist with the Villages Health. Today we're going to talk about the truth about normal aging and dementia. The first question is, what is normal aging? Some signs of aging can start as young as 30 years old. This process of aging can include many changes in our body, including in the areas listed. With our heart and blood vessels, bones, muscles, bowel and bladder, skin, vision, mental health, and even memory and thinking, which is our cognition. So you know that aging will likely cause wrinkles and gray hair, but do you know how aging will affect your teeth, heart, and sexuality? So we're going to go a little bit deeper. With your cardiovascular system, the most common change is the stiffening of the blood vessels in your arteries, causing your heart to work harder and to pump blood through them. The heart muscles change to adjust to this increased workload. Your heart rate at rest will stay about the same, but it won't increase during activities as much as it used to. These changes increase the risk of high blood pressure, which we call hypertension, and other cardiovascular problems. Some changes with our bones, joints, and muscles. With age, our bones tend to shrink in size and in density, weakening them and making them more susceptible to fractures. So you might even become a little bit shorter than you used to be. Our muscles generally lose strength, endurance, and flexibility, which are all factors that can affect your coordination, stability, and balance. With our digestive system, age-related structural changes in the large intestine can result in more constipation in older adults. Some other contributing factors include a lack of exercise, not drinking enough fluids, and a low-fiber diet. Medications such as some diuretics and iron supplements and other certain medical conditions like diabetes might also contribute to some bowel changes such as constipation. Now with our bladder, with age, your bladder may become less elastic, resulting in the need to urinate more often. Weakening of bladder muscles and pelvic floor muscles may make it difficult for you to empty your bladder completely or cause you to lose bladder control, which we call urinary incontinence. Now, in men, an enlarged or inflamed prostate can cause difficult emptying the bladder and incontinence as well. Some other factors that contribute to incontinence include being overweight, some nerve damage from diabetes, certain medications, and caffeine or alcohol consumption. Now, with our memory and thinking, the cognition piece, your brain undergoes changes as you age that may have minor effects on your memory or thinking skills. For example, healthy older adults might forget familiar names or words, or they may find it more difficult to multitask. Now, with our eyes and our ears, with age, you might have difficulty focusing on objects that are close up. You might become more sensitive to glare and have trouble adapting to different levels of light. Aging can also affect your eye's lens, causing a clouded vision, which are called cataracts. Most of us have heard of those. Your hearing also might diminish. You might have some difficulty hearing high frequencies or even following a conversation in a crowded room because of all of the commotion and noise going around you. Now, another thing that we didn't list on our slide here are our teeth. So your gums might pull back from your teeth with age. Certain medications, such as those that treat allergies, asthma, high blood pressure, and high cholesterol, can also cause dry mouth. As a result, your teeth and gums might become slightly more vulnerable to decay and infection. Now, again, these are all things that we know are normal aging. With our skin, with age, your skin thins and becomes less elastic and more fragile, and fatty tissue just below the skin starts to decrease. You might notice that you're bruising more easily. Decreased production of natural oils in our skin might make your skin drier. And wrinkles, age spots, and small growths called skin tags are also common with normal aging. Another factor that we do know is normal with aging is our weight. So how your body burns calories, which is your metabolism, slows down as you age. If you decrease activities as you age, but continue to eat the same foods as usual, you'll gain weight. So to maintain a healthy weight, make sure you're staying active and eating healthy as much as possible. Another thing we do not have listed here on the slide, but is normal with aging. With age, sexual needs and performance might change. Illness or medication might affect your ability to enjoy sex. For women, vaginal dryness can make sex uncomfortable. And for men, impotence might become a concern as well. It might take longer to get an erection, and erections might not be as firm as they used to be. So you can't stop the aging process, but you can make choices that improve your ability to maintain an active life. So these are all things that we do expect, and again, can start as early as the age of 30. So if some of these things are starting to affect you now, that's normal. We can't stop it. So we just learn to live with it and learn what's common. So now we're going to talk about some things that are not normal. Although there are some normal age-related changes in memory and thinking that we did just discuss, confusion and memory loss that interfere with your daily life are not normal. That's not part of the normal aging process. The term dementia is a term for a collection of symptoms of cognitive decline, including disruptions in language, memory, attention, recognition, problem solving, and decision making that interferes with your daily activities. Although about 5.8 million people in the United States have dementia, it is not normal aging of the brain. Healthy brain and Alzheimer's. So on the left is a healthy brain. And on the right side, you can see a brain, an MRI scan of a brain with Alzheimer's. So you can see the different areas that it's circling there at the bottom on the right. Shrinkage is especially severe in the hippocampus, which is an area of the cortex that plays a key role in the formation of new memories. So a lot of time with the short-term memory, with Alzheimer's, we notice that the short-term memory is what is the first to go. So maybe they're able to remember something that happened in their 20s or 30s, but they can't necessarily remember something that happened yesterday. So that is common. We see that often. You can see on the right side there, the cortex shrivels up, damaging the areas involved in thinking, planning, and remembering. So you can see a drastic change from the left to the right side there with a healthy brain, a normal brain with no dementia, compared to the picture on the right with someone that has an Alzheimer's diagnosis. So there's a significant difference there. Now, some common signs of dementia. Now, this is not all of them. There could be some other things, but these are the most common that we see. So if someone is not able to complete tasks independently that in previous years they were able to do completely on their own, now they might require some help or guidance to do those things. Maybe they have some difficulty with naming items or even remembering close family members' names. Forgetting the function of items, say like a toaster or a coffee maker. Maybe they're not really sure what that item does anymore. Sometimes we notice that they repeat the same questions over and over. Some repetitive behaviors are very common with the different forms of dementia. Also taking much longer to complete some customary tasks that is something that that person has been doing for 30 years. Now it takes them a little bit longer because that thinking process is affected by dementia. Also, we see misplacing items is very common. Maybe in the moment, if a person has dementia, they put their keys and their wallet in a spot, thinking that that would be a safe spot and um, no one would take it or it wouldn't get lost. And then the next day, or even a couple hours later, no one knows where the items are, including the person that put them there. So we see that often as well with dementia. Bottom here, not being able to retrace your steps or even getting lost. So this is one that we're quite fearful about, because if you've ever seen on your cell phone a silver alert, that is where an older person is missing. So we see that a lot with people that have dementia as well. Maybe you're not knowing how to get back home. If you go down the street to a neighbor's house or go to check the mail or to the store and you forget how to get home, that is a common sign of dementia that we see. So if any of these things on the slide is something that you or your loved one or a friend has noticed, it's definitely something you should talk to your doctor so they can do some appropriate evaluations to determine if it's normal aging or if it could possibly be dementia or something else. So again, check with your doctor. If you notice some of those things on the previous slide, if you're concerned, check with your doctor first. There are certain medical conditions and vitamin deficiencies like hypothyroidism, which is an underactive thyroid, normal pressure hydrocephalus externa, which is a neurological condition caused by the buildup of fluid in the brain. Even some infections, most commonly we see with urinary tract infections, and even some vitamin deficiencies. All of these things can mimic the symptoms of dementia. So if you're noticing that you have a few of the symptoms on the previous slide, it's a great idea to talk to your doctor, because it may not be dementia. It may be something like your thyroid, or it may be a UTI that you need an antibiotic for. And then once you get these factors under control, maybe the symptoms go away. Also, there are some prescription and over-the-counter medications and supplements that can also cause dementia-like symptoms. So if you, a friend, a loved one, anyone is experiencing any of the symptoms, it's very important to talk to your healthcare provider to find out if there is an underlying cause. Like we said, it may or may not be dementia. It could be something else. So if there is a change, there is a concern, talk to your doctor so they can do the evaluation. Now we'll talk about some ways to keep your brain healthy. So the first one is to any chronic disease prevention. If you have any chronic diseases, make sure you get those things under control. So if you're a smoker, stop smoking. We know smoking can be detrimental to different parts of our body as well as our health, mental and physical. Make sure you maintain a healthy blood pressure level, as well as make sure your cholesterol levels are under control. It's a good idea to talk to your doctor and see where they want all of your different ranges to be. Ask them where they want your blood pressure. Ask them if your cholesterol numbers are under control, as well as your blood sugar, your glucose. Find out if what your numbers are and if they're where your doctor wants them to be. If not, they may suggest medication. They may suggest a lifestyle change, but the combination of all of these things can get these diseases under control, which could then put you at a lower risk for developing dementia. Also, make sure you get to and maintain a healthy weight. If you do drink alcohol, do so in moderation. So the guidelines are up to 1 drink per day for women. And for men under the age of 65, you can have 2 drinks per day. And men over the age of 65, 1 drink per day. Now, again, this is per day, so you can't save them all up until Friday night, date night. If you don't have any drink today, that doesn't mean you get 2 of them tomorrow. It is strictly 1 drink per day, as noted in the guidelines. Number 2 is reduce the hazards in your environment that could lead to falls or head injury. So the recent statistics said that 1 in 3 adults over the age of 65 will fall every year. So if that fall caused you to hit your head, could then lead to a traumatic brain injury and then could put you at a higher risk for developing dementia. So making sure you check your living environment, your socializing environment, make sure there's nothing in the area that could potentially cause you to fall. Number 3 is healthy living. So maintaining a healthy lifestyle, eating whole foods with plenty of nutrients and vitamins. Make sure you're eating lots of fresh fruits, veggies, and whole grains. The second one is exercise. So there are 4 different types of exercise that you should be including in your exercise regimen. There's the endurance, flexibility, strength, and your aerobics. So trying to include all of those pieces is very important. If you can't every day, then alternate every other day. Your strength is the other one. Also make sure you get good sleep. So we all have had nights where if you don't get a good night's rest, you wake up the next day feeling groggy. So imagine that groggy feeling for the rest of your life. Not really being able to focus, not being able to complete tasks at hand. So that could be what it's like living with dementia. So making sure you get on a good sleep routine and sleep regimen and try to stick with it, whether you're home or traveling, is very important. When you're sleeping is when your body gets to regenerate and rest and fight off any infections or anything that's inside. So good sleep is very important. Number 4 is keep your mind active and stimulated with some challenging tasks, like learning a new activity. You can even do some things like put together some furniture, do some puzzles, attend some classes, watch some documentaries, or even research online. Doing something and teaching your brain something new is important because the different areas of our brain need to be stimulated. If you don't use it, you lose it. So we want to make sure we're using all the different areas in our brain. And number 5 is maintain your social contacts. You want to make sure you're doing some type of socialization with someone outside of your home at least twice a week. That social interaction is a very important part of keeping our brain stimulated, making sure you're able to have those full conversations and do these different activities with other people outside of your home helps to keep your brain engaged as well. So the next question, how do I know if my memory issues are normal? So a few things you can do. Keep a log of your concerns, write everything down, and then take that list to your doctor when you go for your appointment. If it's something that you're very concerned about, maybe call and see if you can get an appointment sooner than your routine visit to strictly discuss your memory concerns. Um, ask your family and friends for their input. See if they've noticed any changes as well. Maybe they were too nervous to say anything to you, but there's a good possibility if you've noticed something that they've also noticed a change too. And number 2 on here is you can also request a MOCA. That stands for a Montreal Cognitive Assessment. We do these at the local villages healthcare centers. It's a completely free assessment that triggers the different areas of your brain to see if there are any deficiencies. And it'll tell us where your strengths and weaknesses are. This is not a test that will diagnose anything. It is just an assessment tool that some providers and specialists use to be able to help them to make a decision on a diagnosis. But it's completely free. You don't have to be a patient of the Villages Health to request one of these assessments. You can just call our Learning Center number and ask for a memory screening. And I hope that this has been helpful. There are some normal age-related changes that happen to us, but then dementia is a little more than that. So I hope this brief seminar has explained that a little bit better for you. And if you have any concerns, please talk to your doctor because they will be able to do the evaluations to determine if there is an issue, if there could possibly be dementia. I hope you enjoyed the seminar. If you have any questions, please feel free to contact our Learning Center. And I hope you have a great day.